Overarching statements. Statement 1. The overarching goal of hospital pharmacists is to optimize patient outcomes through the judicious, safe, efficacious, appropriate, and cost-effective use of medicines. This statement establishes the fundamental purpose of hospital pharmacy practice. It emphasizes that the ultimate goal of hospital pharmacists is not simply to supply medicines, but to improve patient outcomes through the responsible and effective use of medications. The statement highlights several important principles, including judicious, safe, efficacious, appropriate, and cost effective medicine use. Together, these principles reflect the pharmacist's responsibility to ensure that patients receive the right medicines in the right way while maximizing therapeutic benefits and minimizing risks. Importantly, this statement places the patient at the center of hospital pharmacy practice and serves as the foundation for all subsequent Basel statements. Statement 2. At a global level, could hospital pharmacy practice guidelines based on evidence should be developed? These guidelines should assist national efforts to define standards across the levels, coverage, and scope of hospital pharmacy services and should include corresponding human resource and training requirements. This statement emphasizes the importance of developing evidence based guidelines to support hospital pharmacy practice at a global level, rather than relying solely on local traditions or individual institutional practices. Hospital pharmacy services should be guided by standards that are informed by scientific evidence and professional consensus. The statement also recognizes that while global guidance is important, implementation occurs at the national and local levels. Therefore, these guidelines should support countries in defining the appropriate levels, coverage, and scope of hospital pharmacy services according to their healthcare needs and resources. Importantly, the statement highlights that professional standards cannot be separated from workforce development. Effective hospital pharmacy services require appropriately trained personnel, competency frameworks, and educational programs that prepare pharmacists to meet professional expectations. This statement laid the foundation for later initiatives aimed at benchmarking, workforce development, competency assessment, and the global advancement of hospital pharmacy practice. Statement 3. The five rights: the right patient, right medicine, right dose, right route, and right time should be fulfilled in all medicines related activities in the hospital. This statement introduces one of the most widely recognized principles of medication safety, the five rights. It emphasizes that every medicine's related activity within the hospital should support the delivery of the right medicine to the right patient at the right dose, by the right route, and at the right time. Importantly, the statement does not limit responsibility to medication administration alone. The five rights should be considered throughout the entire medication use process, including prescribing, procurement, preparation, dispensing, administration, and monitoring. By emphasizing the five rights, the Basel statements reinforce the importance of preventing medication errors and promoting a culture of safety within healthcare organizations. Although the five rights cannot eliminate all medication errors, they provide a fundamental framework for improving medication safety and protecting patients from preventable harm. Reflection question: how does your institution support the achievement of the five rights throughout the medication use process? And what systems are in place to reduce the risk of medication errors? Statement 4. Health authorities and hospital administrators should engage hospital pharmacists in all steps in the hospital medicines use process. This statement emphasizes that hospital pharmacists should be actively involved in all stages of the medicine use process and should not be limited to traditional dispensing or supply functions. The above statements recognize pharmacists as healthcare professionals with specialized expertise in medicines and medication use systems. Therefore, health authorities and hospital administrators should ensure that pharmacists participate in activities such as medicine selection, procurement, prescribing support, preparation, distribution, administration policies, monitoring, medication safety initiatives, and quality improvement programs. By engaging pharmacists throughout the medicine's use process, healthcare organizations can benefit from their expertise in medication management, reduce medication related risks, improve patient safety, and optimize therapeutic outcomes. This statement also highlights the importance of collaboration between pharmacists, physicians, nurses, administrators, and policymakers. Effective medicines management requires a coordinated, multidisciplinary approach in which pharmacists contribute their unique knowledge and skills to support safe and effective patient care. Reflection question: to what extent are hospital pharmacists involved in decision making and medicines related activities throughout the medication use process within your institution? And where could their involvement be strengthened? Statement 5. Health authorities should ensure that each hospital pharmacy is supervised by pharmacists who have completed specialized training in hospital pharmacy. This statement emphasizes the importance of ensuring that hospital pharmacy services are led and supervised by pharmacists who possess specialized knowledge and training in hospital pharmacy practice. Hospital pharmacy is a complex area of practice that extends beyond medicine dispensing and supply management. It involves medication safety, clinical pharmacy services, procurement, formulary management, quality assurance, technology integration, workforce management, and patient centered care. Effective oversight of these activities requires competencies that may not be fully developed through undergraduate pharmacy education alone. The Basel statements, therefore, encourage health authorities to support the development of specialized hospital pharmacy training and to ensure that hospital pharmacy departments are supervised by pharmacists with appropriate qualifications and expertise. The statement also highlights the importance of professional development and workforce capacity building. By investing in specialized education and training, healthcare systems can strengthen leadership, improve the quality of pharmacy services, enhance medication safety, and support better patient outcomes. Reflection question: what specialized training, postgraduate education, or competency requirements are expected for pharmacists who supervise hospital pharmacy services in your healthcare system? And how do these requirements contribute to service quality and patient safety? Statement 6. The chief pharmacist, director of pharmacy, should be the senior professional responsible for coordinating the judicious, safe, efficacious, appropriate, and cost effective use of medicines in the hospital. This statement establishes the leadership role of the chief pharmacist or director of pharmacy within the hospital. It emphasizes that responsibility for coordinating the use of medicines should rest with a senior pharmacy professional who possesses the expertise necessary to oversee medication use systems across the organization. The statement goes beyond operational pharmacy management. It highlights the responsibility of pharmacy leaders to ensure that medicines are used judiciously, safely, effectively, appropriately, and cost effectively throughout the hospital. This includes supporting medication safety initiatives, formulary management, procurement strategies, clinical pharmacy services, quality improvement activities, and interdisciplinary collaboration. By assigning this responsibility to the chief pharmacist or director of pharmacy, the policy statements recognize pharmacists as the healthcare professionals best positioned to provide leadership in medicines management and medication use systems. This statement also serves as an early foundation for concepts that would later become more prominent in the 2024 policy statements, particularly medication safety leadership, governance, accountability, and systems based approaches to improving patient outcomes. Reflection question: does your institution designate a chief pharmacist or director of pharmacy with formal responsibility for coordinating medication use systems? And how does this leadership role contribute to medication safety and quality improvement? Statement 7. Hospital pharmacist authority over the medicine use process should include authority over the selection and use of medicine related devices such as administration devices, giving sets, infusion pumps, and computer controlled dispensing cabinets. This statement recognizes that safe and effective medication use depends not only on medicines themselves, but also on the devices and technologies used throughout the medication use process. Many medication errors and patient safety incidents are associated with the incorrect selection, configuration, or use of medicine-related devices. Examples include infusion pumps, administration sets, automated dispensing cabinets, and other technologies used to prepare, store, dispense, and administer medicines. The Basel statements, therefore, recommend that hospital pharmacists have authority not only over medicines, but also over the selection and use of medicine related devices. This responsibility reflects the pharmacist's expertise in medication use systems and their role in identifying potential risks associated with medication technologies. By involving pharmacists in decisions related to medicine-related devices, hospitals can improve standardization, reduce medication errors, enhance system safety, and ensure that technologies support safe and effective patient care. This statement is particularly noteworthy because it anticipated the growing importance of pharmacy informatics, automation, smart technologies, and digital medication use systems that would become even more prominent in later revisions of the Basel statements. Reflection question: to what extent are hospital pharmacists involved in the selection, evaluation, implementation, and monitoring of medicine related devices and medication use technologies within your institution. Statement 8. Hospital pharmacists should take responsibility for all medicines logistics in hospitals. This statement emphasizes the central role of hospital pharmacists in managing medicines logistics throughout the hospital. Medicines logistics encompasses all activities involved in ensuring that medicines are available when and where they are needed. These activities include procurement, inventory management, storage, distribution, stock control, and the management of medicine shortages and wastage. The policy statements recognize that effective medicines logistics is essential for patient care. Even the most effective medicine cannot benefit a patient if it is unavailable, stored improperly, or distributed inefficiently. For this reason, hospital pharmacists should assume responsibility for coordinating and overseeing medicines logistics systems. This responsibility extends beyond operational efficiency. Effective logistics management contributes directly to medication safety, quality assurance, cost containment, and continuity of care. By leading medicines logistics, pharmacists help ensure that patients receive the right medicines in a timely, safe, and reliable manner. This statement also reinforces the pharmacist's role as a steward of healthcare resources, balancing medicine availability, quality, safety, and financial stability within the hospital environment. Reflection question. How are medicines logistics managed within your institution, and what role do hospital pharmacists play in ensuring medicine availability, inventory control, and supply chain reliability? Statement 9. Hospital pharmacists should serve as a resource regarding all aspects of medicines use and be accessible as a point of contact for healthcare providers. This statement emphasizes the role of hospital pharmacists as the primary experts in medicines and medication use systems within healthcare organizations. Hospital pharmacists possess specialized knowledge regarding medication selection, dosing, administration, interactions, adverse effects, monitoring, formulary management, and safe medication practices. As a result, they should serve as an accessible resource for healthcare professionals seeking guidance on medicines related issues. The statements also highlights the importance of accessibility. Pharmacists should be available as a point of contact for physicians, nurses, and other healthcare providers who require medication related support in their daily practice. Timely access to pharmacy expertise can help optimize treatment decisions, prevent medication errors, improve medication safety, and enhance patient outcomes. Beyond answering medication related questions, pharmacists contribute to evidence based practice, clinical decision making, medication policy development, and multidisciplinary patient care. Their role as a readily available source of medicines information strengthens collaboration across the healthcare team and supports the safe and effective use of medicines throughout the hospital. This statement reflects the transition of hospital pharmacists from primarily operational roles toward more visible clinical and consultative roles within modern healthcare systems. Reflection question. How accessible are hospital pharmacies as medicines information resources within your institution? And how frequently do other healthcare professionals seek their expertise when making medication related decisions? Statement 10. All prescriptions should be reviewed, interpreted, and validated by a hospital pharmacist prior to the medicine being dispensed and administered. This statement emphasizes the critical role of hospital pharmacists in reviewing prescription before medicines are dispensed and administered to patients. Prescription review involves more than simply checking whether a medicine is available. Pharmacists are expected to assess the appropriateness of therapy by evaluating factors such as the indication, dose, route of administration, frequency, duration of treatment, potential drug interaction, allergies, contraindications, duplication of therapy, and patient specific characteristics. The statement highlights three important activities: review, interpretation, and validation. Review refers to evaluating the prescription for accuracy and appropriateness. Interpretation involves understanding the clinical intent of the prescriber and assessing the prescription within the context of the patient condition. Validation confirms that the prescription is suitable for dispensing and administration. By performing these activities before medicines reach the patient, pharmacists serve as an essential safety checkpoint within the medication use process. This helps identify and resolve medication-related problems before they result in patient harm. This statement reflects one of the core clinical responsibilities of hospital pharmacists and reinforces their role in promoting medication safety, optimizing therapy, and supporting high quality patient care. Reflection question: what the processes are in place within your institution to ensure that the prescriptions are reviewed, interpreted, and validated by pharmacists before medicines are dispensed and administered, and what challenges may affect this practice? Statement 11. Hospital pharmacists should monitor patients taking medicines daily or whenever medicines are changed to assure patient safety, appropriate medicine use, and optimal outcomes. When resource limitations do not permit pharmacy monitoring of all patients taking medicines, patient selection criteria should be established to guide pharmacist monitoring. Narration: this statement emphasizes the responsibility of hospital pharmacists to actively monitor patients receiving medicines in order to ensure safe, appropriate, and effective therapy. Medication monitoring is an ongoing process that should occur regularly, particularly when medicines are initiated, discontinued, or modified. Through monitoring activities, pharmacists can identify medication-related problems such as adverse drug reaction, drug interaction, inappropriate dosing, therapeutic duplication, treatment failure, and adherence concerns. The statement recognizes that pharmacist monitoring contributes directly to patient safety and optimal therapeutic outcomes. By assessing the effectiveness and safety of treatment, pharmacists can make recommendations that improve medication use and reduce the risk of harm. Importantly, the statement also acknowledges the reality of resources limitations. In many healthcare settings, pharmacists may not have sufficient time or staffing to monitor every patient receiving medicines. In such situations, hospitals should establish clear patient selection criteria to prioritize patients who are most likely to benefit from pharmacist monitoring. Examples may include patients receiving high risk medicines, critically ill patients, patients with multiple comorbidities, individuals experiencing polypharmacy, or patients with significant changes in therapy. This statement reflects the growing clinical role of hospital pharmacists and highlights the importance of targeting pharmacy services where they can have the greatest impact on patient safety and treatment outcomes. Reflection question: if pharmacist monitoring resources are limited in your institution, what criteria are used to prioritize patients for clinical pharmacy services, and do these criteria adequately identify those at highest risk of medication related problems? Statement 12. Hospital pharmacists should be allowed to access the full patient record. This statement emphasizes that hospital pharmacists require access to the complete patient record in order to perform their responsibilities effectively and safely. Medication-related decisions should be based on a thorough understanding of the patient's clinical condition. Information such as diagnosis, laboratory results, medication history, allergies, vital signs, clinical notes, imaging reports, and treatment plans provides essential context for evaluating the appropriateness, effectiveness, and safety of medication therapy. Without access to comprehensive patient information, pharmacists may be unable to identify medication-related problems, including drug interactions, contraindications, inappropriate dosing, therapeutic duplication, adverse drug reaction, or opportunities for therapy optimization. The Basel statements, therefore, recognize that access to the full patient record is not simply a convenience but a professional necessity. Such access enables pharmacists to contribute more effectively to clinical decision making, medication monitoring, and interdisciplinary patient care. This statement also reflects the evolution of hospital pharmacy from a product focused service toward a patient centered clinical profession. By having access to complete clinical information, pharmacists can function as fully integrated members of the healthcare team and make meaningful contributions to improving patient outcomes. Reflection question: do hospital pharmacists in your institutions have access to the full patient record? And how does the level of access influence their ability to provide safe, effective, and patient centered pharmacy services? Statement 13. Hospital pharmacists should ensure that patients are educated on the appropriate use of their medicines. This statement emphasizes the important role of hospital pharmacists in educating patients about their medicines. Effective medication therapy depends not only on selecting the appropriate treatment, but also ensuring that patients understand how to use their medicines correctly. Patient education may include explaining the purpose of the medicine, the correct dose and administration instructions, expected benefits, potential side effects, precautions, storage requirements, and actions to take if problems occur. Pharmacists should also encourage patients to ask questions and participate actively in decisions related to their treatment. The Basel statements recognize that informed patients are more likely to use medicines safely and appropriately. Education can improve adherence, reduce medication errors, enhance patient confidence, and support better therapeutic outcomes. This statement also reflects the growing emphasis on patient centered care within hospital pharmacy practice. Rather than viewing patients as passive recipients of treatment, pharmacists should help patients become informed partners in the medication use process. By ensuring that patients receive appropriate medication education, hospital pharmacists contribute to safer medicine use, improved treatment effectiveness, and a better overall healthcare experience. Reflection question: how are patients educated about their medicines within your institution? And what role do hospital pharmacists play in ensuring that patients understand how to use their medications safely and effectively? Statement 14. Hospital pharmacists should provide orientation and education to nurses, physicians, and other hospital staff regarding best practices for medicines use. This statement emphasizes the educational role of hospital pharmacists within the healthcare team. Pharmacists possess specialized expertise in medicines and medication use systems, and therefore have an important responsibility to share this knowledge with other healthcare professionals. Orientation and education may be provided to newly appointed staff as well as experienced healthcare professionals. Educational activities can address topics such as medication safety, high alert medicines, prescribing practices, administration techniques, adverse drug reactions, medication error prevention, formulary updates, and evidence based medicine use. The Basel statements recognize that safe medication use is a shared responsibility. Effective collaboration among pharmacists, physicians, nurses, and other healthcare professionals requires a common understanding of best practices and medication related risks. By providing ongoing education and professional support, hospital pharmacists help strengthen medication safety culture, improve clinical practice, reduce medication errors, and promote the safe and effective use of medicines throughout the hospital. This statement also highlights the expanding role of pharmacists as educators, trainers, and professional resources within modern healthcare systems, extending their influence beyond direct patient care to the development of the entire healthcare workforce. Reflection question: what educational programs, orientation activities, or training initiatives are led by hospital pharmacists in your institution? And how do these activities contribute to safer and more effective medicines use? Statement 50. Undergraduate pharmacy curricula should include hospital relevant content, and postgraduate training programs and specializations in hospital pharmacy should be developed. This statement emphasizes the importance of education and training in preparing pharmacists for the increasingly complex demands of hospital pharmacy practice. The Basel statements recognize that undergraduate pharmacy programs should provide students with knowledge and skills relevant to hospital practice. This includes areas such as medication safety, clinical pharmacy, pharmacotherapy, medicines management, hospital systems, interprofessional collaboration, and patient centered care. However, undergraduate education alone may not be sufficient to meet the specialized requirements of modern hospital pharmacy practice. Therefore, the statement also advocates for the development of postgraduate training programs, residency programs, and professional specializations that allow pharmacists to acquire advanced competencies in hospital pharmacy. By strengthening both undergraduate and postgraduate education, healthcare systems can develop a workforce that is better prepared to support medication safety, optimize patient outcomes, contribute to multidisciplinary care, and assume leadership roles within hospital pharmacy services. This statement reflects the growing recognition that hospital pharmacy is a specialized area of a professional practice requiring structured education, advanced training, and ongoing competency development. Reflection question: to what extent do undergraduate pharmacy programs and postgraduate training opportunities in your country prepare pharmacists for the realities and responsibilities of hospital pharmacy practice? Statement 16. Hospital pharmacists should actively engage in research into new methods and systems to improve the use of medicines. This statement emphasizes the important role of hospital pharmacists as contributors to research, innovation, and the advancement of healthcare practice. The policy statements recognize that hospital pharmacy practice should continuously evolve in response to emerging evidence in new technologies, changing healthcare needs, and advances in medication management. To support this evolution, hospital pharmacists should actively participate in research activities aimed at improving the safety, effectiveness, quality, and efficiency of medicines use. Research may focus on a wide range of areas, including medication safety, clinical pharmacy services, prescribing practices, pharmaceutical care models, health technologies, medication use systems, quality improvement initiatives, and patient outcomes. By generating and applying evidence, hospital pharmacists can identify opportunities for improvement, evaluate new approaches, support evidence based decision making, and contribute to the development of best practices. Research also strengthens the professional credibility of hospital pharmacy and supports innovation within healthcare systems. This statement highlights that hospital pharmacists are not only users of evidence but also creators of evidence. Through research and scholarly activity, they help shape the future of hospital pharmacy practice and improve the quality of patient care. Reflection question: how are hospital pharmacists involved in research and quality improvement activities within your institution? And what opportunities exist to generate evidence that could improve medication use systems and patient outcomes?